All right, a couple other housekeeping items is all attendees do automatically have their video and audio turned off, so don't worry about us hearing or seeing you. You're good to go. I do apologize if I have some background noise. I have small children home today and the Frozen soundtrack is blasting in the background, so apologies if you can hear that. Also, I will be checking who is here throughout the course of the presentation for those who want the CESP continuing education credits. So if you are, especially if you are hoping to get the CESP credits, check to see how your name is entered on here. Look at your settings and whatnot and make sure both your first and last name are visible so that I can make sure to give you credit for being here. I also see there's a couple of people who have called in over the phone, and I know you're not going to be able to change what your name is. Feel free, if you are calling in over the phone and you want to make sure to get those CESP credits, to respond to the email I sent earlier today with the link and just let me know that you were here so that I can make sure to give you credit for being in attendance. All right, so Kristy, if you could go to the next slide. I just want to thank the agencies that helped sponsor this virtual conference. Our gold sponsors were Kaposia and Dungarvin, and our silver sponsors were LifeWorks, Accord, Dependable, and Rise. So big thanks to them, especially with some of the adjustments we had to make in switching from an in-person to virtual. Their sponsorships have really helped cover some of those expenses and lost deposits that we had. So we're very grateful to our sponsors. All right, the next slide, Kristy. And then a very quick, I'm sure most of you have become quite familiar with Zoom over the course of the last few months, but just so everyone knows how to use the different functions on a Zoom webinar, at the bottom of your screen, there's a little black panel. And I believe all of the attendees have three things that you should be able to see. There's a chat button, a raise hand button, and a Q&A button. If you need any, especially technical help, if you're having some sort of technology issue, feel free to pop that in the chat and I'll be monitoring that and helping people troubleshoot throughout the course of the presentation. You can also ask questions for the presenters, but it's a little easier if you put questions for the presenters in the Q&A button. So if you put that in, drop the questions in there, and then when the presenters pause for questions, they'll be able to review the questions that are waiting in there. There is also the raise hand function, which you can use during Q&A. If you have a question you really want to ask in person when the presenters are pausing for questions, you can hit that raise hand button, and I'll be trying to monitor to see if anyone has a raised hand, and then I can always unmute you so you can ask that question live. So that's very brief Zoom tutorial. And then I am going to turn it over to Dana Eisfeld, who is one of the Minnesota APSE co-presidents, and he'll be doing just a very brief introduction to what Minnesota APSE is.
Well, thank you, Danielle. And again, welcome everybody to the 2020 Minnesota APSE virtual conference. I am Dana Eisfeld. I work at Dungarvin, and I'm currently a co-president of our state chapter. APSE, through our advocacy efforts and our education initiatives, the entire reason that we exist, our mission is to advance employment and self-sufficiency for all people with disabilities within the state. I've been involved in the field for a little over 10 years now. I joined APSE back in 2011, just when we were getting started. I was learning what customized employment was as a practitioner. And 2014, I became a state board member. And then I currently serve on our public policy committee as well as our communications committee. So what I think primarily for me, the reason that APSE has benefited me so much professionally is that it's a culture of like-minded people that are committed to the same idea. And that idea is not that every Minnesotan with a disability has to work. It's that everybody in Minnesota with a disability that chooses to work, has the ability to exercise that option, and that we have the ability as a state, we've built capacity to provide quality services so that they can reach their potential, their goals, the purpose, and inclusion of employment. And the community around APSE in the last 10 years has really benefited me professionally in that way. Also, I think secondly, as an organization, we get to learn firsthand what other companies are doing, what other advocacy organizations are doing, what the university is doing in terms of research. And whether it's our monthly board meeting, which we're doing on Zoom right now, whether it's our communication committee meeting or it's going to the national or state conference, I'm continually learning things that both benefit me as an individual professional, but also that I can bring back to my organization and say, okay, what are we doing? Are there things that we've learned from other organizations, from cutting edge practices, you know, that are fueled by good research that kind of comes through that network in APSE? Are there things that we can do better so we can continue to refine those best practices? And then lastly, and I think most importantly for me, it's what can I give back? Because I've never really thought about APSE, although it's benefited me and the organizations that I've worked for tremendously. It's also about what can I give back to other people that are looking to do the same thing, because we have that single common mission, which is to help people that want to work get to work. And so my energy and efforts, I hope, have been valuable to our state chapter. So with that, I am going to hand it over to my colleagues at Dungarvin, Kristy, Howe, and Pabalelo, Tshane, who will be leading today's presentation. Thank you.
Thank you, Dana. Good afternoon, everyone. My name is Pabalelo Tshane. I'm also known as PALS. I am an employment program director here at Dungarvin, primarily overseeing services in Anoka County, Riot County, and part of North Hennepin. And I've been with Dungarvin it'll be 5 years next month, and in this field for about the same number of years. But I have over 20 years of experience working with a varied marginalized populations in different settings and different cultures. Over to you, Kristy.
Hi. I'm Kristy Howe. I've been with Dungarvin for about 5 years, working with employment for 5 years. I've been working in the disability services field for over 10. And I oversee employment services primarily in Hennepin and Ramsey County. I've been with Minnesota APSE for 4 years, and I am currently on the conference and training committee. And today we're talking about blended services, how we're all doing employment services during COVID. Specifically, we want to talk about what employment services are available. How do I decide to return to or look for work? Can I find work? What does job searching look like? What safety measures can be taken at work, and what will on-the-job supports look like? These are all questions that I think as providers we hear from person served, parents, guardians, case managers. So we wanted to talk a bit more about that. Yes.
Right. So the question that we ask here and hope to respond to is, what do services look like against the backdrop of COVID-19? The truth is that, things have changed, but while things are changed, and we are still going through a pandemic, but many providers across the state continue to find different ways of adapting to the new normal. So in that sense, services are still available. And by that, I mean employment exploration. We have employment development as well as employment support services that continue to be offered. And providers are still getting referrals from case managers. And as far as staffing goes, providers continue to hire job coaches, employment consultants, as well as employment specialists. Now, what do services look like now, as in October 2020? Right at the beginning of the year, through the mid-year, I would say, many providers temporarily suspended their services in compliance with the CDC protocol that was made at the time. But I'm happy to announce that, right now, many of us providers are close to the pre-COVID service levels. Kristy?
So one of the things that I think we're all running into is, how do we make the decision about whether or not to return to work? There's a lot of elements to consider in this. I think that one of the first places that we should start talking about is how to balance the dignity of risk with the desire for safety. We're all concerned about both of those. So even during the pandemic, well, I guess anytime, we all have the right to make decisions, even when there's risk involved. And during the pandemic, there's pretty significant risk. So DHS has given us some pretty good guidelines along that. They're taking a firm stance that persons served have the right to choose. They have the right to work, even with that risk involved. These are all person-centered services, so the person served is really the one that's guiding that decision. Our role as team members is to help them, is to give them the information they need to make an informed decision. So excellent, strong team communication is really key for this. We can meet, we can talk through everyone's fears, what they're concerned about, and come up with some safety measures, have conversations around that. Part of that conversation should also include talking about the values of work beyond that paycheck, and not just focusing on our fears. So there's obvious financial aspects that are going to kind of sway a person served one way or the other, covering rent, making, paying all their bills. If they aren't concerned about that as much, that can sway the decision another way. I think some of the more subtle questions and aspects that we want to focus on are the mental health benefits of work. Working provides that structure to a day, and it kind of normalizes this experience. We can still go to work, still engage in as many of the activities that we fill our day with as possible. And I think another important aspect that we're all feeling is how can we stay connected to each other, to our communities, and work is a really good way to do that. It's hard to feel like you're part of that bigger community at home, and we see it where people are happier when they're working, when they're that contributing member of society, and that brings about some decrease in some of the emotional and behavioral challenges that we are, I think, all seeing after person served our home for a few weeks, not able to engage in some of those community activities that they typically do. Pass.
All right. So another deciding factor, regarding the decision about whether or not to work concerns the underlying conditions. So I have 3 scenarios here. In the first scenario, you have an individual that has underlying conditions that may make them susceptible to the virus, right? And as Kristy, said, if this person has a strong desire, to pursue employment, depending on where they are at, if they're job searching, if they still want to continue looking for a job, or if they have a job and they do want to continue, staying employed. Our job as our providers is to make sure that, we give them as much information as we can to make sure they are making an informed decision. But if they still decide, yes, I want to pursue employment, then our job is to support them, right? Because as Kristy said, they do have a right to choice. And that support can look like, if it's someone looking for a job, is to help them find a job with a less chances of exposure, right? And once that person gets a job, or if it's someone that already has a job, is now the next step is to talk about safety. How do we make sure that they stay safe while, they're at a job? And part of that, is to encourage them to continue to wear their masks at all times when they are at work, or to social distance if that's a possibility within the environment of their job. Or number three actually, is to constantly wash their jobs, their hands when they're at their jobs. But in the second scenario is where, you have an individual that lives with people that may have underlying conditions. As you know, that the people that we serve, they live in different settings, such as group homes. The most important thing to do here is to make sure that, we include the people that are involved in the conversations about safety. Say, for instance, if it's a group home, you want to make sure that you are including the program directors or the lead staff in that home when you talk about, how can the person, stay safe and keep others safe in the home. So in addition to encouraging the person to make sure that, they wash their hands at work, they wear their mask, the social distance, what do they do when they get to the home? This is a conversation that we want to make sure that, everyone is involved in. And that can look like, Maybe when they get home, before they interact with anybody or they touch anything, they go straight to the bathroom to take a shower. So it's really, really important that we involve everybody that's concerned to make sure that everyone in the home stays safe while, they pursue their goals. Now, in the third scenario, this is where you have somebody that has an underlying conditions, right? But they decide that the risks are too much. I don't want to take that risk. I don't want to look for a job, or I don't want to continue working. I want to halt services, right? Once again, you want to make sure that you are equipping them with the best information, to alleviate any fears that they may have, so that, they make an informed decision. But if they decide, yes, I still don't want to pursue employment in this moment, once again, we have to respect that choice, and then we support them. Now, there's so many things that we can do during that time. There's so many options. You can have the person self, for instance, achieve some of the dreams, that they have had. If someone maybe had wanted to take classes in the past, this is the time that you can encourage them, to pursue that. Or if they want to work on their soft skills or communication skills, this is a time that you can, the job coach can, support the person self in. And I'll give an example. I had a person self that had a job. He's been at this job for, I think, started working in February last year. When the pandemic hit, he struggles with anxiety disorder. So obviously his anxieties, got heightened because of the pandemic. So every time he'd go into work, he'd have, this fear that, oh, I'm going to get exposed, I'm going to get COVID. So he'd make multiple visits to the hospital. So as a team, in the end, he decided, no, he didn't want his job, but we knew how much he loved his job, and we knew that he had a very supportive team, of employers. So the team decided to meet to say, how can we help this person right now? Because his mental health was a little bit out of control. So the team decided, so for the next 2 months, 2-3 months, we worked on a goal to help the person start work on their anxieties, with the goal of, eventually easing him back into that mode, work mode. And what we did in the process is to negotiate with his employer to say, he's going through health issues right now. Can we, instead of him quitting the job that like he wanted to do, can we rather have him apply for a leave of absence? And then the employer said, yes, no, whenever he's ready, wants to come back, we can always negotiate about having him back. So there's a lot more that we can do to get the person stay engaged even when they don't want to pursue employment for now. Kristy?
Another big question that we get is, can I find work? And the answer is yes. I know personally, me and Pabs have both had about 5 or 6 placements over the last month or so. And I know that seems to be pretty consistent across the metro. A lot of this is really dependent on location though, and the local community. So I can only speak to the metro at this point. So a lot of fields are hiring, manufacturing, hospitality, retail, food service, community services, those long-term care facilities. And I know there's a lot of, there's the idea that retail and food services aren't hiring. And we've found that they tend to not be hiring full-time or even like the 20-hour-a-week part-time. But we are finding a lot of places are looking to hire people at the 10 to 15 hour a week, or they're willing to have conversations about that and carve jobs. And that can work really well for a lot of our person serve, like that's what they're looking for, maybe 1 or 2 days a week. It also works really well because a lot of the day programs are running at about halftime. So it can be a really good opportunity to work and go to the day program. Good opportunity for that. Yes.
All right. Thank you. So the question that we ask is, what does job searching look like during a pandemic? And it comes from the question that many providers, are asking ourselves when the pandemic started. The question that we ask is, how can we effectively provide services to continue to meet people where they are while we make sure that everyone stays safe? And this was a deciding factor in, how the different providers, formulated our services. So right now, as the title of our presentation, suggests, we have a blended customized employment services. So this means that we still have, some providers still have, in-person shifts. Now, what these are primarily meant for, say, if a job coach is new to a person's set or vice versa, because these in-person shifts are, important for relationship building, for building that rapport, as well as cultivating trust, because we know that trust is a fundamental element in the type of job that we do. It's very fundamental to service provision. So we do encourage our staff to, for those initial meetings, maybe the first few weeks or the first few months, to schedule the in-person shifts. Now with that comes the issue of safety. How do we make sure that, everyone stays safe, while they pursue their goals? So that, what many providers are doing is to make sure that PPE is staff have access to PPE. And by that, I mean, masks, they have hand sanitizers, they have the disinfectants. And then also it's been nice because, it's been summer, so social distancing has been, possible. We had staff and the person self meeting outside of their homes, in parks, in different places where they could social distance. But if that is not an option, like it's going to be now that winter is coming, where now the staff and the person self, will be forced to meet, in closed buildings like that, we do emphasize the need to wear masks. And this, once again, the communication with the person self and with the team, is very important about safety, because, our goal is to make sure that everyone stays safe. So what that means is that when they're meeting in their homes, they are social distancing as much as they can, but they are wearing masks at all times. And then also, if the staff has to transport the persons out, we do want to make sure that, once again, we communicate the importance of safety. We explain to the persons out why they have to sit at the back of the car. It's not out of respect, but it's because of safety. But we want to make sure that this is communicated with the persons out. And while they're in the car, the persons out is sitting at the back, they are both wearing masks. And then also the staff at the beginning and the end of the shift, they make sure that they disinfect, they wipe down, the car knobs and the interior of the cars, just to make sure that, the car is a safe place for everyone. And then also there is the wellness verification, with the in-person shifts. So what we have our staff doing is every time before they meet with a person's staff, they have to monitor their own, health to make sure they don't have any COVID or like symptoms, and also extend that to the person's staff. Like before a scheduled shift, you call the person's staff, to check if they have any symptoms. And if there's a sickness, that there's communication between the staff and the supervisor, and plans are made for the next shift. Now, when for persons that live in group homes, we really encourage the staff to make sure that they do check with the group home as well, to make sure that everyone is safe in the home. There's no there's no sickness involved. So in addition to in-person shift, we have like I said, the remote services, because as I said, part of adapting to the new normal necessitates some reliance on remote services, which is in turn aided by technology, right? So now when you bring in the element of remote services, the number one thing is to make sure that there's communication with the team members, especially with the person staff. You want to make sure they know exactly what that entails, right? And then ask them the first question, what is our preferred mode of communication? Do they prefer to talk by phone or to use videos? And once that is established, now you move on to the issue of access. Do they have access to a phone, right? And if they do not, what can you do as a job coach or as an employment specialist? What can you do to help them have access to a phone? I know that many counties do pay for cell phones, even though they don't pay for internet. But that's something that the job coach can negotiate with the phone companies, because I do know they have low rates for people that have low income. So that's something that the job coach can, help the person out with. And then the other thing also, once, access has been established, to move on to what times of the week does the person want to be, to engage in remote service? What days, what times of the day? And this is very important also for individuals that live in group homes. You want to make sure that, it's a conducive time for not only the person, but for the people that live with the person staff. If the, maybe for instance, if they are using the house phone, so you want to make sure that you communicate with the residential staff to make sure that it's a good time for the person staff, for two reasons, to make sure that there's less distractions, and then number two, also just for privacy purposes, you want to make sure that the person has privacy when they're engaging in services over the phone. All right, and also, for the staff to have a clear agenda for the day. If you have a scheduled shift for Tuesday noon, you want to make sure that you have an agenda, and you also know if the shift is going to be 2 hours, does the person self want to maybe split that shift, maybe take a 15-minute break. So you want to make sure that, you communicate everything clearly with the person self and the teams. And like I said, remote services, we rely, a lot on technology. And there's a lot of apps that the job coach can explore, alone and with the person staff to aid the job searching process. And one such app is the Career One-Stop app. This is a good resource, for person staff and job coaches to use while they are, looking for employment. Everything is all in, it's one-stop. It's very accessible. And what it does, it helps locate the closest job centers. And it also updates job posting daily according to the zip code, because you put in your zip code, and then it helps every day. It gives you those updates of the new job postings. So this is something that the job coach can work with the person staff, and they can actually give them an assignment. For next time, can you use this app to explore maybe jobs in this area, and the next time when we meet, we're going to discuss what you find against what I found, and then we take it from there. And then another app that I find very useful is the job interview prep questions app. This one, it provides many great interview questions and tips on how to respond to the interview questions. So the job coach can help the person self to summarize the tips, and once again, it's a good way of engaging the person self in the job searching process. You can give them assignments to say, okay, because it gives categories of maybe like the top 10 questions. So you can assign the person self, maybe for our next shift, I want you to practice, responding to questions 1 up to 5. And then next time when we meet, we can review your responses, and I'll give you a mock interview like that. So there is many apps that, the job coach can research and share with the person self to, to smoothen the job searching process. And even the informational interviews, these can still be done either in person, remotely through videos and phone, depending on number one, the comfort level of the person served, as well as the business. Are they willing to do it in person? If not, can they do that? Can it be done through a video? So there's so many options that we can explore. Right, Kristy?
So just like Fabs was saying with job searching, you want to be safe, social distance as much as possible, find a quiet space where there's not a lot of people around. Masks, kind of being mindful about shared devices. If the job coach it's their iPad or laptop, how to use that without kind of passing along germs, using a lot of hand sanitizer in between using those shared devices. So I think that, there's lots of safety measures that we can take. We've got all of those standard precautions that are kind of happening throughout the state: masks, social distancing, hand washing. It's kind of that stuff we were talking about. Beyond that, like the safety measures at work specifically are really based on the type of work that the person served is doing and the level of customization. Some jobs have a clear barrier between employee and customers. Some paid places will have a face shield in addition to a mask. So those are all things that we can talk about at interviews or when communicating with the supervisor about making plans to return after a leave. That's also like a good time to talk about any accommodations the person served specifically is going to need. If they need a face shield, if they need additional breaks to wash their hands, if they need a clear mask. I think we've I've been finding, and I think most of us have been finding, that the employers are being very accommodating with this. They need employees coming into work, doing the work. So those conversations go pretty well. And another thing that you can do is, if you're concerned about it, or if a parent or guardian is concerned about it, they can for sure go in. Like, these are all typically businesses open to the public. So they can just pop in and see how things are going. And then we just have a larger conversation as a team about anything that we might need different. That's
All right. So here's an example of how people can continue to work while staying safe. And this person served here is employed by Howe. She works as a cashier, and she's been at this job for, I'd say it'll be a year on the 31st of October of this month, actually. So she's a good example of someone that has a strong desire to stay employed throughout the pandemic. I remember at the beginning, after that CDC protocol, so Howe had to close the restaurant area. And this is where, because this individual requires, a job coach on site, So this is an area where the job coach would sit, because they can see the person there from a distance without necessarily being in that space, because she's pretty independent. So with that, when the restaurant being closed, now it was tough because she wanted to work, but the job coach could not be on site. So we had a conversation with Howe, and the team decided no, because it's not safe for the job coach, because also Howe also has to, to abide by the protocol. So a decision was made with the person's app that, it might be best that they apply for leave of absence. So that was done. She was on leave for about a month. And just, to emphasize what Kristy talked about, the non-monetary benefits of, staying employed. This individual struggled a lot during that 1 month. She said, she was depressed. She was feeling depressed, and there were reported cases of behavior at the home because, she really wanted to. Her mental health was going down. But fortunately for her, in a month, she was able to go back to work. And when she returned to Howe, everything, they had the safety measures in place. As you can see, they have that glass barrier between the cashier and the customers. And they have the disinfectant there to wipe down the conveyor belts. And also they do provide masks, not only to the employees, as you can see, also for their customers. So it is a very safe place to work at. And they have hand sanitizers like at every corner, accessible to both the employee as well as the customers. So this is one happy person who has stayed employed throughout the pandemic, and she looks forward to going to work every day. And we continue to make sure that she keeps her mask on. She washes her hands as often as she possibly can while she's working. So it is doable. Thank you.
So when thinking about what do on-the-job supports look like, I think the first thing to think about is the person served in the right job. If they're in the right job that's using their skills, their abilities. On-the-job supports they typically go well. We're not needed as much on site. And that can be a really good thing. We want to provide as much support as is needed, but the least amount possible, so the person served can have the greatest level of independence. So typically in normal life, we would provide supports at the beginning of a job, orientation, those first years when they're learning. So as always, we want to talk to the employer, the supervisor, about what that looks like. How can we support them best without kind of disrupting their job or the work? And so it gets a little tricky because right now, not everyone is able to have a job coach on site, or there's more concerns about capacity or increased exposure if it's a vulnerable population. But we really want to have a conversation with the employer about what we can do and kind of think outside the box beyond that standard, like have a job coach on site. So can we like have more natural supports in place? Can there be a coworker who's kind of the go-to person for questions or concerns? Can the supervisor step in and help with that? Check in with the person served more often? Can we have, or would it be helpful to have more breaks throughout the day so the person served can call their staff and check in? Maybe do a little texting back and forth during the shift if they need some support. There's also a lot of apps out there as well to help with this that I think it's really helpful to kind of think outside the box and start using technology. Some that we use is Can Work or AnyDo. Those are really helpful. You can put in task sequencing, put in checklists, have notifications, schedule reminders, some of those prompts throughout the day. So those can be really helpful to increase that independence. And it's, again, that team communication is so helpful. Another thing that kind of goes along with that on the job support is transportation. And we really want to talk through like, what's the best option for the person served? Is it taking Metro Mobility, the bus, Lyft? You know, I know Metro Mobility is running at reduced capacity. They're doing more cleaning, the same with the bus. Lyft and Uber have largely the same practices that a lot of the providers do: masks, sitting in the back seat, disinfecting between people. So that's kind of what a lot of people are doing with their staff. So staff can support and help navigate this. And we are seeing, personally on my caseload, we're seeing more families step into this role. If their person served is living at home, they've made the decision they want to like reduce exposure. So they're just bringing the person served back and forth. So I think this is just a really good opportunity to strengthen that, that team communication and really come up with a plan that works best for that person served. Oh, and then as we are wrapping up the slideshow portion of this, we just want to point out a few resources. We've got the Minnesota APSI podcast that's really interesting. They've had some great interviews on that. It's on YouTube. You can catch the link through Facebook feed. We've Pacer Center is also a really great resource for families. They're kind of that family support go-to. ARC of Minnesota is an advocacy organization. They have a lot of good resources. And these are a few of the apps that we talked about, just in case you weren't able to catch those. Tabs?
All right. Well, thank you for joining us today. If you need more information about the presentation that we gave today, here's our contact information. My email address is up there, ptshane@dungarvin.com. Phone number there, 651-679-6050, extension 5727. And for my colleague, Kristy, her email address is up there, Howe. So Howe@dungarvin.com, 651-699-6050, extension 5721. Thank you so much for having us today.
Thank you.
All right, so now is a chance if anyone has any questions for Kristy and Pabs, you can feel free to put them in the chat, put them in the Q&A, and also if you want to ask any questions live, you can do the raise hand button and I'll try to watch and unmute you if you do that. So does anyone have any questions or comments? All right, well, we'll just give people another few seconds if you have a question to ask it. Kevin says, great job. Nice job, everyone. And just a reminder that the next session will be this Thursday, at noon. All of the sessions will be on Tuesdays and Thursdays at noon over the next 3 weeks, and we will be having a presentation from the state agencies from DEED and DHS, giving it an update about the work they've been doing around the Memorandum of Understanding. All right, I think it looks like that's going to be it then for today. Thank you so much, everyone, for joining us, and we will hopefully see you at a upcoming session.